So what was the turning point that made you decide to focus and start growing your private practice?
Private practice is really important to manage. It's a different kind of patient interaction, and that's what I value most. You have more time with the patient. You get to do more investigations that are necessary. There's no economic constraints that you have on the NHS. You truly can give the patients 100% and the best possible management, if you like. In addition, I was finding that I could manage my patients in a timely manner. So my hernias or my gallbladder surgeries or my colonoscopies weren't waiting several weeks, months, or even up to a year as they were in the NHS. So that for me was a definite bonus. So all those, plus obviously there's the financial incentive and we can't get away from that. If the NHS paid better, then I would do all my work in the NHS. It's as simple as that.
So what business lessons have you learned in private practice that medical school, never prepared you for?
I think that's an interesting question. Medical school is all about learning the subject and then dealing with patients in a very prescriptive manner. Private practice is more of a business really. And that business is about marketing yourself. That business is about making the most of your skills, your talents, and moving forward with that. And medical school doesn't give you the opportunity to promote yourselves, and private practice really is all about entrepreneurship. And I don't think you see many doctors as entrepreneurs. You see a few dentists, and you see quite a lot of pharmacists, but doctors generally are not entrepreneurs. And private practice, whether you like it or not, is a form of entrepreneurship. And I think in order to make the most of that, there's various skills such as marketing, promotion, accounting, and various lessons. So basically, one thing that I learned is do what you're good at and outsource everything else. And that's part of the reason why I'm with Allied Health.
Yeah, I completely agree. Same with me. Whatever I'm good at, I do, and everything else, I hire the team for. I'm completely with you. But yeah, awesome. Can you share a decision you made that significantly boosted your private practice's revenue?
Yeah, for sure. I think the most important thing is marketing. You can't, for want of a better word, sit on your behind and wait for patients to come to you. It's really important to go and grab them. And gone are the days that GPs will just send you patients. We have patients now that Google best colorectal surgeon or best hernia surgeon, and it's the internet presence that's really key to reflect your skills. And improving that and marketing that is where the patients come from. So I would say an internet presence and marketing are the two key things, really.
How do you approach scaling your practice and your business without, having to compromise on the quality of care that you also provide to patients?
I think whilst this is all about scaling practice and making money, you mustn't compromise really on patient care. And that's key. I think you must give each patient the right treatment at the right time, not be too greedy. It's about doing the right thing at the right time for the right patient. And for me, I would do the same thing for NHS patients as I would for private patients, and the management remains the same. I think some of the restrictions around when I can operate and how long they're waiting are different, but all my patients across both sectors get exactly the same treatment from me. And I think that's what's important. You mustn't compromise on your standards of care.
How do you educate potential private patients about your services without sounding salesy?
Yeah, interesting. I think most patients know they need treatment and they know they have a problem and they don't know where to go. So it's providing that direction as to where they should go rather than necessarily selling your service. I think that's the most important thing, really, providing direction, education, and the service as a result.
Yeah, 100% understood. And also, I think you mentioned obviously the marketing a bit earlier. Like for you specifically, what marketing strategies have had like the best return on investment for attracting like self-pay patients for you? I'm
Yeah.
curious. So I'll ask that question more formally. So what marketing strategies have given you the best return on investment for attracting self-pay patients specifically to your medical practice?
We'll edit the wife out. Uh, so, so yeah, lots of strategies. I've tried numerous things in the past. One is Facebook ads, Meta ads. They were okay, but I think we talked about previously the importance of giving people who have a problem direction. You can't really focus with what I do on people coming to a clinic that is really dealing with people ill people. So much better for me was Google Ads, where people are Googling colonoscopy or bowel cancer or inflammatory bowel. So these are patients that already know they have this problem and are then looking for help with it. So I think Google Ads has worked, and also what I'm trying to improve upon is a Google business profile, and I think again that will help amalgamate the sort of marketing for.
Yeah, 100%. And I guess like in this sort of evolving and somewhat crowded like medical consultant market, like how do you future proof your practice against maybe changes or things like how are you thinking about, okay, how can I, yeah, have essentially like a practice that will always be able to serve me and my family? Like how do you think about those things? So I'll say more
Mm.
formally. So what steps are you taking or have you taken to future proof your practice against, maybe perhaps changes in the, medical healthcare system and perhaps, changes in patient pathways as well?
I mean, I think it's important to be at the forefront of medical practice, and that means professional development, continued professional development, attending courses, keeping your training up to date, keeping up with technologies. I mean, I'm a trained robotic surgeon on the way to becoming a trainer in robotic surgery across the country. So that's important, for instance, and I think robotics is where the key is going to be. So I think that's where the key is going to be, and also maintaining high standards. That going on and training in new techniques, in new approaches, and again, the same applies for the NHS. By undergoing a regular appraisals process, by undergoing your regular training, you bring your first class NHS process to the private sector where you don't have many of the constraints of the NHS. So actually it's a win-win, if you like.
So what's one mistake that you made early into your private practice journey that you wish perhaps you could do differently, and what would you have done differently?
I mean, I think private practice is all about being organized, right? And when I started, I wasn't so organized. There was lots of patients that didn't get billed. There was lots of patients that got missed, and that sort of stuff. And you need to have a good secretary, be able to have a process where any inquiries are dealt with very quickly and recorded, and there needs to be a clear contact for these patients. Without that, you lose a lot of work, you lose a lot of time efficiency, which is very important because your biggest commodity in the private sector is time, right? So the more time you're spending doing silly things, the less time you are making money. And I think every minute counts in the private sector. So you need to have the processes around you being as efficient as possible. And the biggest mistake I made was not having those efficient processes around me.
The last one is just AI, and I guess because obviously that's a super interesting part, and it's coming into different aspects of the medical industry, whether it's maybe on the business side or the clinical side. Uh,
Mm.
how have you implemented AI and AI agents or automations in your private practice, whether it be maybe from the marketing side, the business, or the clinical? And has it been changing anything in the way you do things over the past 24 months?
It's an interesting question. There's no escaping from AI. I think it's going to be part and parcel of everything we do, both in medical care and in life. I think it's easier to say what AI probably will not replace, and that is the doctor-patient interaction. That's an adequate history and examining and experience. And whilst AI, the way it works is uses thousands of people's different experiences to come up with a sort of a model that's likely to have the right answer. Medicine and surgery is about more than just pattern recognition, and what's right for you may not be right for someone else with exactly the same symptoms, and that's about tailoring the right treatment to the right patient. It's Savile Row compared to Marks and Spencer when it comes to suits, and it's that management is exactly the same, and I think that's where the difference will be.